Hi everyone. In today's clip, I will talk a little bit about cataracts. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So cataracts are clouding of the lens of the eye, resulting in changes to vision. A cataract can develop in one eye at a time or both simultaneously. The lens of the eye consists of normally clear tissue that focuses light onto retina, the layer of nerve cells lining the back wall of the inside of the eye. And in the retina, light is converted to nerve signals that communicate information to the brain. There are also certain types of cataracts that can develop during childhood or due to surgery, trauma, or use of certain drugs or other health problems. Cataracts tend to grow progressively worse, causing vision impairment that may interfere with the daily activities. The most common initial symptoms of cataract is a small area of blurred vision. Over time, this area of blurred vision is likely to grow as the lens becomes more clouded. Eventually, the person may get the sense that their overall vision is dull or it's blurry. Now, along with the vision that gets progressively blurrier, they may also experience color changes in the lens that causes everything they look at to take a yellowish or brownish cast. Eventually, they may have trouble distinguishing colors, particularly shades of blue and purple, as well as performing tasks that require distinguishing colors, including reading. Other than cloudy vision and color changes, symptoms of cataracts can include poor night vision, sensitivity to lamp, headlights, or sunlight, halos around lights, double vision, frequent changes to glasses or contact prescriptions. The lens of the eye consists mostly of protein and water. The lens is located behind the pupil and iris, the black and colored areas of the eye, which are covered by cornea, the clear outer layer of the eye. The proteins in the lens are arranged in a way that keep the lens clear. But because of some changes that may happen, these proteins can begin to clump together, resulting in cloudy sort of areas of the vision. Over time, these protein clumps can grow larger and affecting the greater area of the vision. A number of sort of factors can increase the risk of developing cataracts, including living at a higher altitude, diabetes, high blood pressure, history of eye injury, inflammation or surgery, radiation treatments on the upper body, smoking, drinking excess alcohol, or long-term use of corticosteroid drugs. So some people are even born with cataracts, as I mentioned, or develop them during childhood. These are known as congenital cataracts. Sometimes congenital cataracts can be due to trauma or infection in the uterus. Congenital cataracts don't always affect the vision, but if they do, they're usually treated with surgery soon after they are diagnosed. Cataracts are usually diagnosed by an eye doctor, an optometrist or ophthalmologist, using a variety of eye and vision tests. The person may need a dilated eye exam in which drops are placed in the eye to make the pupils widen so the doctor can see into the interiors of the eyes more easily. Other tests can include things like visual acuity tests, in which you are asked to sort of read a series of letters from a chart. There's slit lamp exam, which is an eye doctor using a special microscope to view structures in the front of the eye in detail. Retinal exam, And for this test, your eyes have to be dilated, and the eye doctor uses a slit lamp or another device to view the backs of the eyes. Normally, they recommend wearing sunglasses to slow the progression of cataracts. So I am personally very much against sunglasses to begin with. I see nowadays even young children are wearing them. Our eyes need exposure to natural light and sunlight for optimal function and overall eye health. And wearing sunglasses not only interferes with that, but also it will impact our circadian rhythm. Natural light spectrum exposure, including UV, plays a role in melatonin production, which is a powerful anti-cancer hormone, and blocking the rays with sunglasses interferes with this. Also, our eyes are designed to adapt to varying light levels. Use of sunglasses hinders this natural process and makes the muscles lazy, as well as the eye will have a hard time adjusting to changing light conditions. The frame of the sunglasses also obstructs the peripheral vision, which is crucial for situational awareness. Also, the dark lens on the sunglasses causes the pupils to dilate, allowing more UV rays entering the eyes and potentially causing damage to cornea, lens, which leads to cataracts, and retina, which leads to macular degeneration and even ocular cancers. There are different types of cataracts. We have age-related cataracts. This group accounts for the large majority of cataracts, which I feel age has nothing to do with it if we properly care for the eye during our years. There's congenital cataracts and cataracts in babies and children that can be caused by a number of different factors. Then there's secondary cataracts in adults. These are the cataracts that can be caused due to disease like diabetes or by drugs, as I mentioned, like corticosteroids. Then there is traumatic cataracts, which is an injury to one or both eyes that may result in cataracts. This can happen soon after the injury or several years later. Cataracts can also be categorized by the area of the lens that they affect. There are 3 types of cataract locations. We have nuclear cataracts. This type of cataract affects the center of the lens, and it tends to cause yellowing and clouding of the area. Then we have cortical cataracts, and this type of cataract affects the edges of the lens. It tends to cause white marks and streaks that gradually extend to the center of the lens. Then we have posterior subcapsular cataracts, and this type of cataract affects the back of the lens, and it tends to cause an initially small opaque area in the path of the vision, and often progresses much faster than the other types of cataracts. To treat cataracts, they suggest surgery to replace the lens in the eye with an artificial lens. There are currently no medications for this in the market. To prevent eye ailments, including cataracts, the best advice is to lower oxidative stress by stopping smoking, reducing excess weight, eating a clean diet along with multivitamin and additional supplements such as vitamin C, 3,000 to 6,000 milligrams a day in divided doses, vitamin E, 400 to 1,200 international unit of natural mixed tocopherols, and tocoterols, and this will greatly help prevent oxidation of the tissue in the eye. Now, next I'm going to give you a formula that we have used successfully to naturally reverse cataracts, but please do not do this without consulting your healthcare provider. This is an old natural remedy that I used on my mom and few other family members, and all with 100% success. In this formula, I mixed equal small amounts of onion juice, ginger juice, lemon juice, and honey. The products are organic and they're properly washed. And the honey is not Billy Bee, it's real honey. I mixed the juice as well, and dropped 2 drops in each eye. It burns like you have never felt before for about few minutes, and then it subsides. I do not have eye issues myself, but I use it every couple of months for a week or so for strengthening the eyes. Now, from person to person it is different, but I did this twice a day for my mom for about 3 weeks, and her eyes cleared up and did not require any surgery. The mixture can be kept in the fridge in a dark bottle. I did not make too much of it, and every week I made a small fresh batch. Whatever is left over in the batch, I just drink it actually, which is very good. So that's the remedy that we used to use, and I'm still using for myself. So poking castor oil massaged over the eyelids and with the heat applied also is quite effective for about 15 to 20 minutes every time, or half an hour, as well as lymphatic massages to drain the stagnant fluids, especially at the back of the head. If you sort of track from the earlobes back over here, there are 2 pits over here that needs to be massaged regularly. Usually if you massage them for about 10 to 15 minutes, that opens up the channels. Emotionally and metaphysically speaking, the person with cataracts is not able to see ahead with joy. They cannot see the bright future ahead of themselves. Hope this has been helpful. Like and follow for more. Be the light.